Welcome back to the OHSU Effect Inside Health and Science. I'm Lacey Evans, and this morning we're talking about hoarding. And of course, we've seen it on reality TV shows, but it's a obsessive-compulsive disorder where a person collects so many items and they have the inability to discard them, and it really affects the way they function and the way they live. So with me now, again, is Dr. James Hancey, the director of the Outpatient Psychiatry Clinic at OHSU. Good morning. Thanks for continuing the conversation with us.
Thank you.
So I wanted to ask you, is there a profile of a typical hoarder?
There is not really. We just simply have not developed a profile.
So it could affect anybody.
That's right.
Is it easier to combat in its earlier stages before it gets too out of hand?
The big issue there, of course, is the lack of recognition that this is a developing problem. And so typically it does not come to the attention of for treatment until it's a pretty significant issue.
Until it's really bad.
Correct.
Which could take a long time to find out because, as you mentioned earlier, a lot of times the person is ashamed, and so they might keep this a secret from friends and family.
Correct. That's most often the case.
Yeah. Well, we've seen this a lot on reality TV shows. There's a lot of TV shows focused on this and people kind of laugh and make fun of it, but it's really a serious thing. First of all, do you watch those shows? How accurate do you think they are?
I have seen a few of those shows, and they are accurate, actually, in terms of the degree. And actually, we've had a couple of the people in our group about OHSU were on one of those shows.
Really?
Yeah.
Are you able to talk about how they felt being on that show?
I think it was different for the two people. There was initially a lot of embarrassment and shame associated with it, but I think that the issue was that they felt like it might be helpful for people.
So these shows have really brought this issue to the forefront, but is this a newer disorder or has it always been around?
It's always been around, and I think we're much more aware of it. It's much more talked about, but I think typically in the past, people didn't really have much of a name for it. But now that the name is out in the common parlance, it's more widely recognized.
Which has some benefits. More people will be getting help, possibly.
That hopefully, yes.
Yeah, good. So you mentioned earlier that children can become hoarders. So I would like you to talk more about that.
Usually, there are limitations imposed by the parents on it so that it does not get to the degree or magnitude that it does with adults. But children can develop this issue of not wanting to get rid of things. As I said, either because of the magical thinking or that something bad might happen if they throw this away. For example, I was consulted on a case of a child in Eastern Oregon who had read that the landfills were filling up, and so he did not want to contribute to the problem, so he became very adamant that they couldn't throw anything away.
Well, it's cute to think about him being so earth conscious, but what can a parent tell a child like that to make him know that it's okay? I
think each individual case is a little bit different, but I think the thing to keep in mind is that childhood should be a time of fun, not when kids should be worried about filling up the landfills.
Yeah. Well, what is the first step for someone to seek treatment?
The first step really is the acknowledgement that this is an issue and something does need to be done by it. And frequently that comes from an exogenous factor. It's like the landlord sort of saying you will be evicted if you don't do something. But the next step then really is to contact an appropriate kind of venue to get that treatment. Okay.
So if a family member, though, realizes that, let's say their sister is a hoarder, even though the sister won't admit, can the family member call someone and try to get her help, or really it needs to be the person?
Really, it needs to be the person because otherwise there's a lot of resentment. A lot of times people will come to an OCD support group that I run simply to gain a little bit of information and say, look, my family member is a hoarder. What are the resources? What can be done? And find out a little bit about what is available. And then they will go back to the family member and armed with some information about the possible treatment options.
Well, that's great. You mentioned your OCD support group. What other services does OHSU offer?
In terms of the actual therapy for the hoarding, we do not have people who can go out to the home. I rely on a number of outside therapists to do that. Pacific University has a clinic, training clinic, and frequently they are involved in going out to the individual homes.
But you offer support groups for families?
And we have a support group that for OCD, and family members are welcome to attend that.
And what about, I guess, not the outpatient stuff going to the home, but what do you provide for the hoarder once they're ready to come in and get treatment?
We can do the medication piece at our clinic and some certain amount of limited cognitive behavioral therapy. But as I say, we don't have the resources to go out to the individual's home.
Sure, sure. Well, how can a person get a hold of you or your clinic?
They can call the OHSU Psychiatry Clinic. That number is 503-494-8613.
All right. That information is also going to be on our website, ohsueffect.org. You can also find that at kxl.com and just look for the OHSU Effect page. You can also call the OHSU main number. It's 503-494-8311. They'll have all of today's information, and if you heard something on a past show and you'd like to be hooked up with that doctor, they can help you with that as well. Dr. James Hancey, the director of the Outpatient Psychiatry Clinic at OHSU, thanks for being here.
Thank you.
And don't forget, we offer the OHSU Effect as podcasts on our website, kxl.com. Just look for the OHSU Effect page. And if there is a health topic you'd like us to cover here on the show, you can send me an email, lacey.evans@kxl.com, or you can follow me on Twitter @LaceyEvans and send me your suggestions. Coming up in 5 minutes, we'll talk to Dr. Eric Orwall, the Assistant Vice President for Research at OHSU. He'll tell us about clinical trials and medical research and how you can contribute. Tell us about the different trials happening at OHSU. There are hundreds going on right now. Some involve people with disease, others involve the study of the brain or the musculoskeletal system. You don't need to have an illness to participate, and they are always looking for new volunteers. And next week on the show, we'll talk about your travel plans and how algae could interfere. There are different kinds of water-based toxins out there. Some of them harmful to humans and pets, others not. We'll tell you about the different kinds, and we'll tell you what researchers at OHSU are doing to monitor and detect the algae blooms. Also, we'll talk to Dr. Ann Sang, whose expertise is travel medicine. She'll have health tips if you're traveling abroad and what to do if you get hurt in a foreign country. She'll also advise us on different vaccines we may need before that vacation. That's next week on the OHSU Effect. But first, Dr. Eric Orwall and clinical trials, just 5 minutes away.